My name is Kelvin Ramsey. I'm a consultant plastic and reconstructive surgeon working in London. The coronavirus pandemic has been a challenge for everybody, both patients and surgeons and doctors alike, as you can probably imagine. Right at the beginning, in the spring of 2020, the health service, both for private patients and for NHS patients, changed dramatically overnight. In the early stages of the hard lockdowns, we only were looking after patients who needed urgent, life-saving or extremely urgent procedures. And appropriately, we did not perform any other operations that could be delayed because we were trying to minimize the exposure of patients to coronavirus. Over the last 18 months, the world has changed and the health services have changed. Pathways have been put in place to make it safer for patients to come through the hospital environment for many reasons. At times when the coronavirus pandemic has been at its height and we've been in lockdowns, once again, we've been adjusting the procedures that we've been doing to make sure that we're not exposing anybody, patients or staff alike, to an unnecessary risk from the virus. Fortunately, in the UK, we seem to, with the assistance of the vaccine programme, we are seeming to be on the way out, I would hope. Coronavirus we will be living with for many years, but I think from a healthcare point of view, things are looking much more favourable, and we have safe pathways for urgent and non-urgent procedures to make sure that everybody's looked after, but also to make sure that patients get their much needed operations. At the moment, the answer to that question, fortunately, is yes. So whether it's a reconstructive procedure for cancer surgery, or whether it's subsequent adjustments or even aesthetic procedures, both myself and the vast majority of my colleagues are carrying out such operations at the moment. If we go into a fourth wave, or if this current third wave escalates further and the hospitals start becoming full again, then we may need to adjust the patient pathways and maybe even have to turn patients away or postpone their surgery. But I think that is very unlikely to happen from now on because so many of the adult population in this country are vaccinated. So the answer to this question, fortunately now, is yes. In last spring, in March 2020, the answer was no. We were prioritising the urgent cases only, but all reconstructive and aesthetic procedures are being safely performed at present. There is always a small wait to have an operation from the time that you're seen in the outpatient clinic to the operation date from a logistical point of view, to arrange appropriate preoperative assessments, arrange theatre time, and ensure that sufficient consultation and consent processes have been completed. Within the NHS, there are some significant waiting lists at the moment, unfortunately, because of the backlog after the pandemic. But within the private sector, the waiting lists are much less. Obviously, patients are still prioritised within both sectors if they have urgent problems such as cancer, but within the private sector for non-urgent procedures, the waiting lists are very manageable at present. The pandemic has changed the health service in both the private sector and the NHS sector permanently, I would suggest. The way that patients are consented about the risks from the virus preoperatively, the patient pathway both through the hospital and the outpatient clinics to ensure all appropriate PPE measures are put in place to ensure the safety of the patients and the staff. They are routine measures now. I think unless coronavirus completely disappears, I think these measures are going to be with us for many years to come. Essentially, from a patient point of view, it is we will lead them through every step of the way, so they don't need to worry about remembering anything. They will be guided every step of the way, and they should be reassured that they should be no more likely to be exposed to coronavirus within a hospital environment than they will walking down the street with the measures that are put in place. This is a very important question. The early data that came out of China in spring 2020, and then further data that came from the entire international surgical community in the early stages of the pandemic, did show that if you had coronavirus at the time of an operation, this was dangerous. You would get, you were likely to get much worse symptoms from coronavirus if you're recovering from an operation, because your immune system is slightly reduced as a result of the recovery from surgery. Therefore, we take many precautions to make sure that patients are isolated preoperatively. At the moment, in the vast majority of hospitals, this is somewhere between 3 days and a week. And there are testing procedures to ensure that you do not have coronavirus when you come into hospital for your surgery. So essentially, there are a number of questionnaires that patients are asked to ensure that they do not have any symptoms at the time of their surgery or in the few days prior to their operation, just to make sure that we don't let anyone slip through the gaps and expose a patient to an operation when they have the virus. A further follow-on question is, if I have COVID and I'm testing positive but I'm asymptomatic, can I still have the operation? And I'm afraid the answer to that question is no, because you may be asymptomatic at present, but once you're in the post-operative period, you may become symptomatic and become more unwell. And then the last question from that is, how long do I have to wait if I've got COVID for my surgery? And in my practice, the answer to that question is at least 7 weeks, just because we know from the long-term data that you are fully recovered and not more likely to have an adverse outcome from your surgery if you've waited 7 weeks from the resolution of your symptoms and from having a negative test.